Let's continue our bone discussion by looking at articulations. Now, articulations are joints or anywhere that two or more bones come together. Of course, there are many places in the body where that happens. These joints can be very different. Some of them are very freely movable. Some of them may have very little movement. Some may have no movement at all. That structure that you'll find there is based on what kind of movement you're going to get. Naming joints has been done in many different ways. You might just run the names of the bones together, like the temporomandibular gets its name from the temporal bone and the mandible. You might do it according to just one of the bones, like the humeral for the humerus and the upper brachial region. You might just look at the Latin equivalent. Cubital means elbow, so there you look at that elbow joint. They've been named in many different ways throughout the years. Look at the classification of joints found here. Now, two ways you can classify joints is either based on their structure or their function. Let's first look at their structure. If you look at these three different structural classifications, the first one you see is a fibrous joint. These types of joints are bound and held together by collagen fibers. Remember, collagen fibers are very, very strong, like little steel cables. So this will be good for binding and holding bones together. You also have cartilaginous joints. Obviously, the ones where cartilage is found in between the bones. And of your three different types of cartilage, you'll either see hyaline or fibro, not the elastic. And then lastly, there's the synovial joint. These are the most complex of the joints, and these have fluid-filled cavities or spaces called bursa. We'll look at those a little further along. You can also look at their function, looking at how much movement you have in these joints. The synarthrosis are non-movable. In other words, no movement between the bones there. The amphiarthrosis, where there's just a small amount of movement, and the diarthrosis, where there's a large amount of movement. Now look at these fibrous joints right here. The sutures in between the flat bones of the skull are great examples of where you find them. Now where these bones meet, they'll talk about how they interdigitate. Sort of like if you take your fingers and put them together, you slide them together, you get tiny little spaces in between those digits or fingers, but not much of anything. And that's what these little jagged lines in between these bones look like. The periosteum, which is that outer connective tissue layer that covers the bone, is continuous from one bone to the next. So if you look back at these sutural ligaments, you probably saw some of these back in the previous videos where we looked at the anatomy of the skull. Those suture lines are great examples of these fibrous joints. As an adult, they all tend to fuse together given enough time. But when we're young, you'll see soft spots where there's still connective tissue in between these flat bones of the skull where the suture lines will be. And that's what fontanelles are, soft spots on a baby's head. Makes that head more flexible during childbirth. That's why these fibrous joints of the skull form in that way, so that head will have flexibility at that time. There's another type of fibrous joint called a syndesmosis. Here the bones are a little bit further apart than what you see in the suture, but they are joined by ligaments. If you were to look in between your radius and ulna, remember that's those two bones in your forearm, there's lots of strong fibers, lots of collagen fibers forming ligaments, binding and holding these bones together. There's not much movement in between them, a little bit more than what you might see with the flat bones of the skull, but not much. Another type of fibrous joint is a gomphosis. These are specialized into one particular place, where your teeth fit into the alveolar processes of the maxilla and mandible. It's the only place we have little peg and socket joints. Now look at the cartilaginous joints. Again, now we've got cartilage in between the bones. Look what we see, a synchondrosis where we've got hyaline cartilage and a symphysis where we got fibrocartilage. Again, you're not going to see the elastic cartilage holding bones together. That stuff stretches way too easy. Wouldn't be good for binding and holding them at all. So looking here at the synchondrosis. Again, you've got hyaline cartilage in these joints here. Little to no movement. And a great example of that is in between your sternum and your ribs. You actually put your hand there and feel that sternocostal cartilage. You can't tell what's bone and what's hyaline cartilage. That hyaline cartilage is very strong material. It's going to hold those ribs to that sternum, give a very strong connection. But there can be a dislocation between that cartilage and that rib, but somebody'd have to take an awful hard hit for that to happen because that's strong tissue. Looking at the symphysis here, we've looked at one of these in a previous video, the symphysis pubis. Here's where you got fibrocartilage binding and holding those two front halves of the pelvis together. Again, you got one of these big coxal bones on each side, and there's that cartilage right in between them, binding and holding them together. Look on the synovial joints. Now again, these are the most complex of those joints. Here you've got synovial fluid inside this joint, a very slippery material. Helps to reduce the friction in between that hard hyaline cartilage and anything else that's in that joint. Make it very slippery. That way those parts won't wear down and get destroyed quicker than possible. It's just like putting motor oil in your car. Everybody knows you don't put oil in your engine, those parts are going to rub and they're going to wear and you're going to destroy it quickly. Same thing would happen with the bones where you got them coming together. And if you look at where you find most of these synovial joints, out in the appendicular skeleton is the best place to find them. So if you want to look at a synovial joint, one good place to go is at your knee, right there. So you are going to have this articular cartilage. Remember, that's just cartilage at an articulation, at a joint. You're going to have over the ends of these bones, very hard, smooth, glass-like hyaline cartilage. That's good for reducing friction. You put in there with them the synovial fluid that's very slippery, and that'll help to cut down on the friction more. Now there's a tough outer region called a fibrous capsule. It's dense connective tissue, lots of collagen there. But then the inner layer is the synovial membrane, and that's where that synovial fluid comes from. It's filled with a substance called hyaluronic acid, and again, that's what cuts down on the friction. It's just like putting WD-40 or something such as that in between two hard metal parts. It'll reduce the friction, parts ought to last longer. Also, something else you see here in your knee are the meniscus. These fibrocartilage pads, they're like cushions or shock absorbers in the knee. Figure every time you step, that's a lot of weight coming down on these fibrocartilage pads. Those pads are great cushions acting as shock absorbers. Then inside these synovial joints, you won't find blood vessels or nerves. Since this is a pressure point, they'd probably just get constricted and that'd either cut off blood flow or they cause pain if you ever put pressure on a nerve. But because there aren't any blood vessels penetrating the inside of this joint, that's why that joint is slow to heal. Anywhere you got a large blood supply, it'll heal quicker. Anywhere you got less of a blood supply, it's going to take longer. There's also a type of sensory receptor in these capsules. These type of sensory receptor are called proprioceptors, and they take changes in tension. You'll see these in another chapter, but by detecting changes in tension, it can do different things like let you know how heavy an object you're holding or what your body position is, even if your eyes are closed and you can't see it. You'll see these more in a future chapter. So looking at some of those structures you see in those synovial joints, there's the bursa. That's that fluid-filled cavity or space. If you overuse that joint, you might get a little bit of damage, and bursitis, inflammation of that joint, is what you'd have. It's lots of ligaments and tendons. Remember, the ligaments bind bone to bone, the tendons bone to muscle. Helps to stabilize this joint. There's lots of them there. You probably heard about some of these like the ACL, PCL, and others being damaged when somebody gets hit around that knee. The articular discs are found in different places. Look at this first one listed here like the temporomandibular. You ever felt your jaw pop? There's a very strong cushion pad in between that mandible and that temporal bone where they come together. So you see those in high pressure points such as that. The meniscus are the name of those particular fibrocartilage pads down in your knees. There's two of them, a medial and a lateral one. And there again are the tendon sheaths that we mentioned before. Now let's also look at some different types of synovial joints. And these have been classified by looking at the shape of the bone wherever they come together. So first you got a plane joint, also called a gliding joint. Here's where you'll have two flat opposing surfaces coming together. Great example of this is the bodies of your vertebrae. Remember, you look at something like that thoracic region, lumbar region, or whatever, you got this round body shaped about like a hockey puck. Well, those are two flat opposing surfaces coming together. They just slide a little left, right, forward, back, and anywhere in between. That's why they call that a gliding joint. Not a lot of motion, but you can move in pretty much any direction. Saddle joints, if you look right at the base of your thumb at that carpometacarpal joint, it looks like you took one saddle and set it upside down on top of another one. That's where the saddle joint gets its name. Hinge joints, think like a hinge on a door. Best example of where you find this is in your elbow. If you look at that trochlea, which is one of those rounded ends of that humerus, it fits into the ulna at the trochlear notch. So what you have is basically something that's round like a cylinder fitting into something that's C-shaped. And if you look at like the hinge on a door, that's the general idea. Pivot joints are going to rotate around a single axis. Good place to find this is you think about it, if you hold up your hand and you twist your hand, right, left and right, prone and supine motions and such. We'll look at those further down the line. But if you turn your hand, say palm up and palm down, that radius bone spins. It turns on its long axis. If you could see the end of it like that head, you can see it is rotating. That's what will give you a pivot joint. After that are the ball and socket. Now these are only found in two places, your shoulder and your hip, where the head of your femur fits into that acetabulum, those deep depressions on either side, left and right. That's those big coxal bones you find that acetabulum inside of, and also up here in your shoulder. The head of that humerus fitting into that glenoid cavity of that scapula is another place. Now these ball and socket joints give you the widest range of motion. That's good. But wherever you have more motion in a joint, they're less stable. And that's why those are often damaged quite a bit. And then lastly down here we got this ellipsoid, also called a condyloid joint. It's a modified ball and socket joint where instead of being round like a ball and socket, sort of like if you took the round part and made it a little bit oblong, sort of like an egg or football shape. So it's taking on that ellipsoid shape. And if you look at the condyles of the occipital bone, where they fit into the superior articular facets of the first cervical vertebrae is a good example of that type of joint.